So today we just want to cover a topic that may be new to some of you. It's the idea of community spread. You may have heard Dr. Acton speak to this or the news speak to this several times over the last week or so. Now, essentially what we mean by community spread is that the idea that the virus, COVID-19, is moving through our community unseen at this point, that it is so endemic to our environment that it is truly being spread without connection to a known case. In Ohio, we have community spread that is unquestionable at this point. As testing continues, we see more and more cases of that be recognized. Because it is in Ohio through community spread, we have to assume there are cases of COVID-19 within Union County. So then the question becomes, what is testing for at this point, and why is testing so restricted? Right now, testing in Union County is very restricted to only the most severely ill and those who are most vulnerable to spreading COVID-19. And you ask yourself, why would we want it to be that way? When a person presents with severe illness and goes into our healthcare system, there are certain measures in place, protocols that have to be taken to ensure they don't spread the disease to other folks. And that requires resources that are very limited in our community. So when a person comes in, suspect COVID-19 and is going to be tested, is to determine whether that level of protection, those level of resources have to be devoted to that person, or can they be moved out of that level into a step down so that those resources, those very specific resources to control disease, are available for the next suspect case. Without having that protection, we face the very real possibility that as a surge occurs, we do not have the capability of dealing with all the cases that could appear. This is what Dr. Acton has been speaking about for the last week. This is what the governor's messages have been about. How do we slow the spread of the disease? How do we flatten that curve? And our healthcare system is a critical piece of that. We want to make sure all of our healthcare partners are available to deal with what they deal with every day, as well as the surge of cases of COVID-19. For everyone else to do their part, it's very simple. First and foremost, hand washing, hand washing, hand washing. We cannot stress that enough. Hand washing frequently, maintaining social distancing and good respiratory etiquette, meaning covering your cough and your sneeze. And absolutely critically important, when you are ill, stay home. If you have been told by a healthcare provider you are ill and you need to self-isolate or quarantine for whatever reason, take that advice seriously. That is the only way we're going to manage our resources and get through the disease.